Hello, guys. Welcome to our YouTube channel, Behavioral Medicine. As part of my health psychology assignment, I am here presenting an activity that most of us enjoy doing it, and it is swimming. So, let's understand what swimming is. Swimming refers to the pushing of body through the water with the help of limbs to move in a desired direction. History of swimming dates back to Stone Age artworks from around 10,000 years prior. In 1538, Nicholas Weyman, a Swiss educator of dialects, composed the first book about swimming, The Swimmer, or a dialogue on the art of swimming. Some of the important equipments for swimming are the swimsuit, swim cap, goggles, and kickboard, etc. So now let's look into the swimming styles. First one is the freestyle. This is a very classic swimming posture where one lies on the stomach and flutter their legs while alternating the arms in a windmill motion and they move forward. Second comes the backstroke. Here, the person lie on their back and flutter the legs while circling the arms in a windmill motion. This is very similar to the freestyle, but you swim backward and move backward. Third comes the breaststroke, where one float on the stomach facing down, then move the arms in a half circle motion in front of the body. Bend the legs, then kick back with good timing, and you propel yourself up and forward. Fourth comes the butterfly stroke. The butterfly is performed by bringing the arms up above your head and then pushing them down into the water to propel yourself forward. So here are some of the videos depicting the different styles of swimming done by me and my friend. Here are some of the benefits of swimming. First one, water-based exercises can help people with arthritis improve the use of their arthritic joints without worsening the symptoms. Swimming can improve mood in both men and women. Swimming can decrease anxiety, and exercise therapy in warm water can decrease depression and improve mood. Swimming can benefit older adults by improving their quality of life, decreasing the disability. It can also improve or help maintain the bone health of postmenopausal women. Here is a research article that I thought would help you understand the benefits of swimming. 45 asthmatic children were enrolled in a swimming program in Baltimore. To assess the clinical effects of the program on the enrolled children, a central evaluation service was established in the allergic clinic of the Department of Pediatrics, University of Maryland School of Medicine. After participating in a 2-month swimming session, the children showed significant improvement in all clinical variables, including symptoms, hospitalizations, emergency room visits, and school absenteeism, compared with their previous medical history. These health benefits continued to be observed even 12 months after the session had been completed. There was an improvement in all the clinical variables as long as 12 months after the 2-month long session of 24 swimming days had ended. Let's look at the adverse events of swimming. Injury to the shoulder and knee is by far the most common injury while swimming. People can experience muscle cramps and muscle tightness as well. Though these are not classified as injuries, they still can create pain and discomfort. Dehydration. Dehydration is actually a critical disadvantage that can really affect one's well being. One big misconception people have about swimming is that they don't think they sweat when they're in the water. Sweating is our body's natural way to cool down when we are hot or overheating. The sweat factors can be the biggest contributor to become dehydrated while swimming. The speed at which one might become dehydrated without proper water can also be affected by the temperature of the pool we are swimming in. Infections. One can get bacterial infections from the water depending on where they swim. Even if a pool is treated with chemicals, bacteria can still survive. This is where a small drop of pool water with bacteria becomes trapped in one's ear. If the bacteria is not removed, it can grow and develop into an incredibly uncomfortable ear infection. Last but not the least, chemical complications. Swimming pool chemicals are a necessary part of maintaining a hygienic training and swimming environment. If it wasn't for chemicals such as chlorine in the water, pools would most likely become contaminated and dirty very quickly. These chemicals do have some risks involved with them and aren't necessarily the most healthy thing. Chlorine and bromine are the two main chemicals used in pools. These chemicals may cause dry skin, frail hair, irritated eyes, and allergic reactions on the body. Here are some of the diseases caused due to swimming. First one is sauna rash. Certain germs in heated pools and hot springs tend to react with the skin and cause a bad itchy rash. This is also known as hot tub rash since the germs become more active when exposed to high temperature water. The bacteria responsible for the spread of this infection is Pseudomonas. Second, swimmer's ear. When we swim, it is widespread to have water enter our ear and nose cavities. While this is temporary and gets out on its own, a nasty condition can arise when the water gets trapped in the passageway or ear canal, thereby allowing bacteria and some other kinds of fungi to grow in the moist places. These bacterial infections, while they can go away on their own, can cause very bad swelling, pain, and terrible itching. It is also more common in kids than adults. Diarrhea. Diarrhea is not just a stomach problem that happens when we eat something wrong. Even when we go to take a dip in the water, we are putting ourselves at risk of catching a bad cause of diarrhea. The germs that cause cholera and diarrhea can contaminate the swimming pool and hamper our health. Even swallowing a tiny amount of water from the collection is enough to infect. Respiratory problems. For those with breathing disorders and pulmonary issues, ensuring safety and cleanliness in the swimming pool is one of the utmost importance. Even if the swimming pool is moderately contaminated, certain germs like the bacterium can infest or collect in the nox and cervix and even disperse with steam and mist. It can be straightforward to ingest these, leading to breathing problem. People of age 50 and older, young children, and pregnant women, and those suffering from chronic infections and low immunity should be extremely cautious about this, as such germy diseases can also turn fatal. I hope my presentation was helpful for you. Thank you for watching. Please like, share, and subscribe. Please like,